Nutrition Hero Podcast. Igniting both the art and the science of functional medicine. Here's your host, Dr. Brad Watts.
Hello, ladies and gentlemen. Welcome back to the Nutrition Hero Podcast. This is Dr. Brad Watts. Thank you for being with me here today. I'm a doctor of chiropractic and an expert in functional medicine and clinical nutrition. And we're here today to talk about nutrition on the Nutrition Hero Podcast. So thank you for joining me. If you are new to the podcast, please subscribe. If you're finding this content valuable, share it with your friends. For all those of you that have been with us for the last several years, thank you for subscribing. Thank you for sharing it with people that you know and love and people that can use the content that we're curating. So remember, I'm not a researcher, I'm a curator, I'm a provider, I'm a doctor that wants to see patients. And so you got to make sure you're working with things that work. You don't have time for things that don't work. And today, we're going to talk about something along those lines. So today I was doing some research one of the things I get to do is product research for a company in the marketplace, Biogenetics, and we're looking at some technology for a new fish oil product, and it's really about using a monoglyceride instead of ethyl esters for fish oil. So difference, we'll talk about this. Well, let me just give you a quick nutshell. This is from Nutricy in Canada, so just a couple of checks here, okay? Both triglycerides and ethyl esters are esterified forms of a fish oil, which means that an ester link or a bond holds the fatty acids onto their chemical backbone. The fatty acids in a monoglyceride are held to a glycerol backbone, where the fatty acids in ethyl ester are held to an ethanol, an alcohol backbone. So we talk about a fish oil traditionally being bound to an alcohol backbone, or this technology that I was researching, a fish oil being bound to a glycerol backbone. Essentially, you can think of like a triglyceride. Instead of a triglyceride, it's a monoglyceride. Right? So anyway, the technology had me thinking, and so I went on a little bit of an expedition through PubMed, and I want to just lay a couple of things on you that I found regarding fish oils. Then you're going to get some commentary on that as well. So when we look at fish oil, everybody and their brother knows that the value of fish oil is going to be in a cardiovascular perspective, right? We talk about some of the benefits where it changes the LDL particle size. So remember, we want low amounts of LDL cholesterol, but we want large particle sizes. When you have small LDL particle size, it's like sand. It gets stuck everywhere, right? In every crack, so to speak. And when we look at that, the same thing happens in the cardiovascular system. If you have endothelial dysfunction or you have a tear in the endothelium, you don't want sand packing that tear, that little micro wound. When that happens, we get a pileup. So what we want is large LDL particles that don't pack well. Large LDL particles. And I think in functional medicine, at least for many providers out there, might not be you, but for many people, we end up thinking about LDL. Smaller is better, less is better all the time. Well, actually, larger is better. Smaller volume of LDL cholesterol is better. So larger particle number, or larger particle size, and smaller LDL cholesterol volume is better. So if you want more information on that, do plenty of different webinars, etc. for Biogenetics on that type of a topic. But as far as this podcast is concerned, understand cardiovascular effect of using omega-3 fish oils is profound. Profound. And don't let anybody tell you otherwise. I see in the media, even recently, talking about how fish oil is a scam and all this kind of stuff, right? And anytime I see research like that, I always say, compared to what? And for who? Compared to what and for who? Right? And so we got to make sure we're measuring the proper data points in order to see the proper changes. If we're looking at fish oil lowering cholesterol, well, that's not likely going to happen. If we're talking about fish oil lowering a patient's A1C, It's not likely going to happen as a standalone intervention. And remember, when you're going through testing for supplements or medications, whatever they might be, they're controlling for one data point, right? If we take 100 people and they all eat however they want to eat, and you give them fish oil, do their data points change? Right? That's the only intervention, is the fish oil. You know as well as I do that one intervention in a multifaceted 50 facets in this multifaceted condition, one intervention is not going to yield the result you're looking for. It requires a symphony of changes. Lifestyle intervention is not add fish oil. All right, so when you're reading the medical literature, you have to make sure that you're seeing what they're measuring. What are they measuring against? Very rarely is it a fair shake for lifestyle intervention, because you got a bunch of scientists that can't talk to people trying to measure an intervention with people. So what are they going to do? Going to put them through lifestyle coaching measures? No. We're going to change one thing, see how it turns. Change one thing, see how it measures. Change one thing, see what develops. And the cardiovascular world is the same thing. Right? So just reading through some of the literature here, this one said, journal title, Beneficial Effects of Omega-3 Fatty Acid on LDL Particle Size in Patients with Type 2 Diabetes, already under statin therapy. Right? Have you ever seen a diabetic patient that wasn't already under statin therapy? It's pretty rare. Right? But what they found is after 8 weeks of treatment between people that were taking statins by themselves or people that were taking statins and 4 grams of omega-3 fatty acids, what they found is a significant change in triglyceride content, and LDL particle size went up. It went up. The LDL cholesterol value didn't drop, but the particle size went up. That means the carrier, the size of the carrier went up. So instead of sand particles, we now have boulders. Still with the same amount of LDL cholesterol being carried, right? But sand went away. Boulders showed up. What is that? That's a net benefit for this patient's cardiovascular function. Well, you're mitigating risk. Mitigating risk. Now, one of the things I found out in going through the research as I was looking at this technology and trying to decide and give my input to biogenetics, should you acquire this technology for your fish oil? Right, one of the things that I found out is that modern medicine has been taking the active ingredient from EPA-DHA, putting it into a pharmaceutical product and selling that into the marketplace so that you don't get the full benefit of EPA-DHA, you just get the cardiovascular benefit. And I see their point if they want to have a controlled substance that has marketable value, right, to a specific group. But here's my question. What if that specific group has cardiovascular disease and rheumatoid arthritis and asthma and cancer? Right, what if this group that they're marketing to has more than one condition? Why would you take out the cardiovascular effect, put it into a capsule, and give them only the cardiovascular effect? Kind of insidious. Right? It's a business decision. It's a business decision. And it's sick. I want to show you this, all right? All right. So next study that I found here was from a couple of years later, 2015. Says the effect of DHA, monoglyceride, on systemic hypertension and cardiovascular dysfunction. Here's my summary. Rather than supplying a single molecule or metabolite, right, which is the pharmaceutical model, if you use EPA-DHA appropriately in this monoglyceride version that I was researching, they get the expected and desirable benefits of the metabolites of EPA-DHA as well, rather than a single metabolite being sequestered, put into a capsule, and given to patients that have a single problem. See, this drives me crazy when you see this kind of stuff in the marketplace. It's like being able to help people in 5 different areas, but only giving them one benefit because you're only able to profit off of one of those. Like, you wouldn't do this as a natural health care provider. I hope you wouldn't do this. You wouldn't do that. If you have the ability to help somebody, then stinking help them. Even if the thing you're using to help them solves 5 problems and you're only getting paid to address one of them. That right there, in a nutshell, is the problem with modern medicine. And so I read that, and I had to throw that out there and say, do you guys see this as well? Are you seeing this? It should motivate you to talk with your patients. Right? Talk with them. Educate them to the extent that you are comfortable on the value of lifestyle. Lifestyle, solving multiple problems through one specific plan. Lifestyle. Is this resonating with you? I hope this resonates with you, because I was on fire when I read that. Okay? Oh, man. So just a couple of other things here, okay? The monoglyceride version of EPA resolves lung inflammation in allergic models of asthma. So there's animal studies here where they talked about dampening the pro-inflammatory markers interleukin 4, 5, 13, COX-2 without having to use COX-2 inhibitors. This is amazing. Right? Amazing. Allergic models of asthma. So we're talking things like dust, mold, pollen. Allergic model of asthma being improved by the monoglyceride versions of EPA. Are you using monoglyceride version of EPA right now? Right? I read through that and I was like, well, I got 6 kids now that I think I can put this product in their lifestyle and see how they do. I don't personally have 6 kids. I'm saying 6 patients that are kids. So, all right. So you got EPA. Here's another study. EPA, DPA monoglycerides are more potent than straight DHA to resolve inflammation in a rheumatoid arthritis model. Are you using EPA monoglycerides? Right, if you're using this Maximil technology that I'm going to talk about here in a second, you are. Right, but check this. Right, so we have morphological and histological analyses revealed that the monoglyceride EPA exhibited strong activity in reducing the progression and severity of arthritic conditions in an animal model, especially rheumatoid. The plasma levels of the pro-inflammatory cytokines interleukin 17, 6, and TNF-alpha markedly lower when compared to the untreated animal population. Results also revealed decreased activation of NF-kappa beta pathways. NF-kappa beta, we talk about that ad nauseum on this podcast, and that chills out the expression of TNF-alpha, obviously, as well. So MMP9, for those of you that have been supporting patients that have like Marcons, right? Of interest, the combined treatment, right, of monoglyceride EPA and vitamin E displayed an antagonistic effect on anti-inflammatory properties versus just using monoglyceride EPA. So what they're saying is if you're using an EPA that's blended with vitamin E, it doesn't work. It was the monoglyceride EPA, right, by itself that had the anti-inflammatory effect. Here's another study. Antiproliferative effects of new, right, DPA monoglycerides in colorectal carcinoma cells. Get this. Right, get this. Where's the study? All right. The results demonstrated that monoglyceride DHA, EPA, and DPA all decreased cell proliferation and induced apoptosis into cancer cells, having higher antiproliferative and pro-apoptotic effects. Period. That is amazing. Right? Amazing. In the animal model, it significantly inhibited tumor growth. Amazing. Right? Furthermore, monoglyceride DPA treatments decreased NF-kappa beta activation, leading to reduced COX-2 activity, MMP9 VEGF expression levels, and tumor tissue secretions. Altogether, this is new evidence, the mode of action, right? Monoglyceride, EPA, DPA, DHA in colorectal cancer cells. Phenomenal. Phenomenal. right? But here's the rub. Patient being treated for cardiovascular disease, they don't get to experience any of that because they're on a pharmaceutical version of fish oil, which is limiting the effect to the cardiovascular system, because there are other treatment measures for asthma, other treatment measures for rheumatoid arthritis, other treatment measures for cancers, carcinomas. Those other treatment measures, I would bet the farm are more expensive. I bet the farm. And that's what you see bear out in the mainstream medical situation right now. Right? And it drives me nuts. Drives me nuts. What happened to the doctors, like the old school family doctors, right, that just want to help people? Where'd they go? Where'd they go? What happened to the doctor that can help somebody because they have the ability to? Not tomorrow, now. Why? Because I'm here now. Right? Not with 17 new and different products. With this one. Why? Because you have a condition that falls under the support needs of this one specific product. This is what I'm talking about. Right? I really hope that 2021 is the year where we start to see providers willing to help patients no longer need their services. Is natural health care ready to stop churning? Is primary care ready to stop churning? Are you willing to help people to such an extent that they don't need you anymore? Are you willing to do it? Right? I'm saying we got to do that. We got to be there. And just researching just a little bit on this monoglyceride technology for a fish oil, you get exposed to some of the insidious things that are underneath the surface in cardiovascular care. Man, got me. I just had to share it with you. I don't usually do Brad's journal on the Nutrition Hero podcast, but today I just felt like I needed to expose that and just see if we can activate something in you that is willing to help patients to the extent that they don't need your help anymore. Are you willing to be that kind of provider? 2021, let's let that be the target this year. Right? Not that you don't like your patients, but help them so that you don't ever have to see them again. Right? They're going to end up coming to you for everything but toilet paper and bananas. They're going to end up referring their friends to you. Why? Because I'm willing to help you to the extent that you no longer need me. That's what I'm talking about. All right. Thank you for tuning in to this brief episode of Nutrition Hero Podcast. Make sure that you are subscribing, thumbs up. Make sure you're sharing it with your friends. Especially this quick hit on omega-3 fatty acid. All right. Blessings, everybody.